All right, now Tracy's gonna show us donning and doffing here in Golden for our aerosol generating procedures. So she is gonna start with donning, doing her quick pre-donning check. She's in her hospital scrub. She's got all of her extra junk out of her pockets. Her vocera is in a position where she can access it through her gown. Perfect. And she is ready to go. So she can start with hand hygiene, and then she is going to put on her N95 mask. And she's reusing her practice N95 mask for the purposes of our show. So the one band should be high up on her head, and the one band is low to the back of her head. She's using both hands, not pinching the top of the nose piece, but both hands to smooth down over her nose. It's pulled down under her chin, nice and far, and then she's gonna be using both hands up around the edges of her mask to check for both positive and negative leak tests. We do have thorough instructions posted at the isolation carts if you're needing help step by step for that. The next piece is going to be her bouffant or bandana style hair protection. When putting that bouffant on, you want to make sure you're getting all of your hair into it, and it's coming down low, covering the entire of your ears, so tucked below. You got a little bit more hair hanging out. On your left side. Almost there. Good. Next is the face shield. Again, using that face shield, she's gonna cover like an overlap with the bouffant, and making sure it's positioned an okay size that it's covering around towards her ears and down towards her chin. And she's going to put on an impermeable gown tied high around the neck in a single bow, and then tied towards the side so that she can reach it. An important thing to consider here is if we're wearing our shield and or our mask for extended periods of time, when you're donning your gown, making sure that your chin is up nice and high so that you're not contaminating yourself while you're donning your gown to go in and do patient care. Good. Now she can put on the nitrile gloves, getting as much cuff coverage as possible. Now we'll go over doffing of the aerosol PPE. So in the ante room, this is because all of our aerosol generating procedures should be done in 337. You're going to enter the ante room, perform hand hygiene on your gloved hands. Good. Remove the gloves, same way as before, trying to ensure that you're not touching the outer surface. Yep. And then dropping into the garbage. Perform hand hygiene again. Removing your gown Untie at the neck and at the side, making sure to keep your chin up so you're not contaminating that shield or mask. And again, leaning slightly forward, trying to only touch the inside of that gown, rolling the gown down and drop into the laundry bin or garbage, depending on what you're wearing. Perform hand hygiene. Remove your face shield, making sure you're leaning forward with your eyes closed, and only grabbing towards the back of that strap. Remove overhead and place shield in bin. Likely we'll be placing our shield in the bin for reprocessing. So that's the goggle and shield bin in the anteroom. Perform hand hygiene. Now you're going to remove your bouffant or bandana style hair protection. Again, leaning forward over the garbage. Close your eyes and pull that bouffant off from the top of your head. There you go. Less chance of contaminating yourself. Drop it into the garbage. Perform hand hygiene. Now you're going to exit the anteroom. Perform hand hygiene. Now you're going to be removing your N95 mask immediately outside of the anteroom. Again, you're going to lean forward slightly, bending at the waist, not just at the chin. With your eyes closed, you're going to remove that lower strap. Ideally, you can sometimes keep a little bit of tension on that lower strap so that it doesn't pop back onto your face, and pull it down and away from your face. There you go. And drop your N95 mask into the garbage.